Hello, nursing students. Welcome to Nursing Exam Preparation, your ultimate resource for excelling in nursing exams with confidence. In today's video, we'll take you through 150 multiple-choice questions, MCQs, on hypertension, high blood pressure, each designed to challenge your knowledge and deepen your understanding of this critical topic. Each question is followed by a detailed explanation to help you not only answer correctly, but also understand the reasoning behind each choice. Whether you're just starting your studies or reviewing for your exams, this video offers valuable content to enhance your critical thinking, test your skills, and solidify key concepts in hypertension nursing. Don't forget to like, share with your classmates, and subscribe to Nursing Exam Preparation for more essential resources. Hit the bell icon to stay updated on our latest videos, all created to help you succeed. Once you've finished the video, let us know your score in the comments below. We'd love to hear how you did. Let's get started and work together toward mastering hypertension nursing and achieving exam success. Common risk factor for primary hypertension. A. Smoking. B. Family history of hypertension. C. Obesity. D. High sodium intake. Answer. B. Family history of hypertension. Rationale. Primary hypertension, also known as essential hypertension, is most often caused by genetic factors, with family history being a major risk factor. While smoking, obesity, and high sodium intake are contributing factors, they are more associated with secondary hypertension or modifiable risk factors. 2. Which of the following is the most appropriate first-line medication for a patient with stage 1 hypertension and no comorbidities? A. ACE inhibitor. B. Diuretic. C. Calcium channel blocker. D. Beta blocker. Answer. B. Diuretic. Rationale. Thiazide diuretics are the most common first-line treatment for stage 1 hypertension in patients without comorbidities. They are effective in lowering blood pressure and have a proven track record for reducing complications like stroke and heart failure. 3. A nurse is educating a patient with hypertension about the DASH diet. Which of the following is a key feature of the DASH diet? A. Increased saturated fat intake. B. High intake of red meat. C. Increased sodium intake. D. Increased consumption of fruits and vegetables. Answer. D. Increased consumption of fruits and vegetables. Rationale. The DASH, dietary approaches to stop hypertension, diet emphasizes a high intake of fruits, vegetables, whole grains, and low-fat dairy, with reduced saturated fat and sodium intake. This diet helps reduce blood pressure. 4. Which of the following is a common complication of untreated or poorly controlled hypertension? A. Osteoporosis. B. Stroke. C. Asthma. D. Sleep apnea. Answer. B. Stroke. Rationale. Untreated or poorly controlled hypertension can lead to a number of serious complications, including stroke, due to the increased pressure on blood vessels in the brain, which may lead to rupture or clot formation. 5. A nurse is reviewing the blood pressure measurement technique with a patient. Which of the following actions is correct when taking an accurate blood pressure measurement? A. The cuff should be placed over the patient's clothing. B. The patient should be seated with legs crossed. C. The patient should rest for at least 5 minutes before measurement. D. The stethoscope should be placed directly on the skin. Answer. C. The patient should rest for at least 5 minutes before measurement. Rationale. Resting for at least 5 minutes ensures that the blood pressure measurement reflects the patient's true baseline, avoiding factors like stress or activity that could cause an inaccurate reading. 6. Which of the following is a potential cause of secondary hypertension? A. Obesity. B. Hyperthyroidism. C. Family history. D. High salt intake. Answer. B. Hyperthyroidism. Rationale. Secondary hypertension occurs when a specific underlying condition causes elevated blood pressure. Hyperthyroidism can increase cardiac output and raise blood pressure. Obesity and high salt intake are risk factors but do not directly cause secondary hypertension. 7. A patient with hypertension is started on an ACE inhibitor. What is the most important side effect of this class of drugs the nurse should monitor? A. Hyperkalemia. B. Hypoglycemia. C. Hypocalcemia. D. Hypercalcemia. Answer. A. Hyperkalemia. Rationale: ACE inhibitors can cause hyperkalemia, elevated potassium levels, because they inhibit aldosterone secretion, leading to reduced potassium excretion. Monitoring potassium levels is essential to avoid dangerous arrhythmias. 8. A nurse is teaching a patient with hypertension about the importance of medication adherence. Which of the following is the best strategy to improve adherence? A. Encourage the patient to take the medication only when blood pressure is high. B. Suggest the patient take medications at the same time every day. C. Recommend the patient stop medications if they feel fine. D. Advise the patient to take medications only during periods of stress. Answer: B. Suggest the patient take medications at the same time every day. Rationale: taking medications at the same time every day helps reinforce adherence and ensures that blood pressure remains controlled. Stopping medications or taking them only during stress or when blood pressure is high can lead to poor outcomes. 9. A 65-year-old patient with a long history of uncontrolled hypertension presents with sudden weakness, slurred speech, and facial drooping. What is the most likely diagnosis? A. Stroke. B. Hypoglycemia. C. Seizure. D. Acute myocardial infarction. Answer: A. Stroke. Rationale: these are classic signs of a stroke, which is a common complication of uncontrolled hypertension. Hypertension increases the risk of ischemic or hemorrhagic stroke due to the pressure it places on blood vessels in the brain. 10. Which of the following blood pressure readings is indicative of stage 2 hypertension? A. 120/80 mmHg. B. 130/85 mmHg. C. 140/90 mmHg. D. 160/100 mmHg. Answer: D. 160/100 mmHg. Rationale: stage 2 hypertension is defined by a systolic blood pressure of 140 millimeters of mercury or higher, or a diastolic blood pressure of 90 millimeters of mercury or higher. The reading of 160/100 mmHg qualifies as stage 2 hypertension. 11. A patient with hypertension is prescribed a beta blocker. Which of the following effects is most commonly associated with beta blockers in the management of hypertension? A. Increased heart rate. B. Decreased contractility. C. Decreased renal perfusion. D. Increased cardiac output. Answer: B. Decreased contractility. Rationale: beta blockers decrease heart rate and contractility, which lowers cardiac output and thus blood pressure. They are effective in treating hypertension and conditions like heart failure or angina. 12. A patient with newly diagnosed hypertension is given lifestyle modification recommendations. Which of the following is most important for managing blood pressure? A. Limiting alcohol consumption. B. Drinking 8 glasses of water per day. C. Engaging in high-impact aerobic exercise daily. D. Increasing daily caffeine intake. Answer: A. Limiting alcohol consumption. Rationale: limiting alcohol intake is crucial for managing blood pressure. Excessive alcohol consumption can increase blood pressure and interfere with antihypertensive treatments. Other lifestyle changes, such as exercise and reducing caffeine, also contribute to better blood pressure control. 13. Which of the following diagnostic tests is commonly used to assess end organ damage in patients with hypertension? A. Chest X-ray. B. Electrocardiogram, ECG. C. Urinalysis. D. Brain MRI. Answer: B. Electrocardiogram, ECG. Rationale: an ECG is used to assess heart function and detect damage caused by hypertension, such as left ventricular hypertrophy or arrhythmias. While urinalysis and brain MRI may be used in some cases, the ECG is a primary diagnostic tool in evaluating hypertension-related damage. 14. A patient with uncontrolled hypertension is at risk for which of the following complications? A. Chronic obstructive pulmonary disease, COPD. B. Renal failure. C. Liver cirrhosis. D. Gastritis. Answer: B. Renal failure. Rationale: chronic hypertension can damage the kidneys over time, leading to nephropathy and eventually renal failure. High blood pressure causes increased pressure within the glomeruli, which can impair kidney function. 15. A nurse is reviewing the blood pressure measurement technique with a patient. Which of the following is correct? A. The cuff should be placed over the patient's clothing. B. The patient should be seated with legs crossed. C. The patient should rest for at least 5 minutes before measurement. D. The stethoscope should be placed directly on the skin. Answer: C. The patient should rest for at least 5 minutes before measurement. Rationale: resting for at least 5 minutes ensures that the blood pressure measurement reflects the patient's true baseline, avoiding factors like stress or activity that could cause an inaccurate reading. 16. A patient with hypertension is prescribed a calcium channel blocker. Which of the following is the primary action of this medication class? A. Decrease in peripheral vascular resistance. B. Inhibition of aldosterone secretion. C. Increase in heart rate. D. Blockade of beta-adrenergic receptors. Answer: A. Decrease in peripheral vascular resistance. Rationale: calcium channel blockers reduce vascular resistance by relaxing smooth muscle in the arterial walls, thereby lowering blood pressure. They do not directly affect aldosterone or heart rate as much as beta blockers do. 17. A patient with a history of hypertension is at increased risk for which of the following ocular complications? A. Cataracts. B. Glaucoma. C. Retinopathy. D. Macular degeneration. Answer: C. Retinopathy. Rationale: hypertension can damage the retinal vessels, leading to hypertensive retinopathy. This is a common complication of long-standing uncontrolled hypertension and can result in visual impairment. 18. Which of the following is the most common symptom of hypertension? A. Nausea. B. Headache. C. Dizziness. D. Hypertension often has no symptoms. Answer: D. Hypertension often has no symptoms. Rationale: hypertension is often referred to as the silent killer because it usually has no symptoms until significant damage to organs occurs. Many patients do not experience symptoms until complications like stroke or kidney damage arise. 19. A 55-year-old patient is being treated for hypertension with a thiazide diuretic. Which of the following laboratory results is most important to monitor regularly? A. Potassium levels. B. Calcium levels. C. Glucose levels. D. Sodium levels. Answer: A. Potassium levels. Rationale: thiazide diuretics can cause hypokalemia, low potassium levels, which may lead to dangerous arrhythmias. Regular monitoring of potassium is crucial to avoid this complication. 20. A nurse is caring for a patient who is being treated for hypertension and asks why blood pressure medications are necessary even though the patient feels fine. The nurse's best response would be: A. You will feel fine until you have a stroke or heart attack. B. Blood pressure medications will make you feel better overall. C. High blood pressure can cause long-term damage to your heart and kidneys. D. You only need medications if your blood pressure goes over 140/90 mmHg. Answer: C. High blood pressure can cause long-term damage to your heart and kidneys. Rationale: even though the patient may feel fine, hypertension can lead to irreversible organ damage, such as heart failure, kidney failure, and stroke. Ongoing treatment is necessary to prevent these complications. 21. A nurse is educating a patient about the role of the renin-angiotensin-aldosterone system, RAS, in hypertension. Which of the following describes the function of aldosterone? A. Increases sodium excretion by the kidneys. B. Increases potassium excretion by the kidneys. C. Increases water retention by the kidneys. D. Decreases blood volume and pressure. Answer: C. Increases water retention by the kidneys. Rationale: aldosterone increases sodium and water retention by the kidneys, which leads to increased blood volume and elevated blood pressure. This is one of the mechanisms contributing to hypertension. 22. A 70-year-old patient with hypertension is prescribed an angiotensin II receptor blocker, ARB. Which of the following is the most common side effect associated with ARBs? A. Cough. B. Hyperkalemia. C. Angioedema. D. Hypotension. Answer: B. Hyperkalemia. Rationale: ARBs, like ACE inhibitors, can cause hyperkalemia because they block the effects of aldosterone, reducing potassium excretion. Cough and angioedema are more commonly associated with ACE inhibitors. 23. The nurse is educating a patient with hypertension about the importance of weight loss. Which of the following is the most likely outcome of weight loss in hypertensive patients? A. Increased blood pressure. B. Decreased blood pressure. C. Increased risk of heart disease. D. Decreased kidney function. Answer: B. Decreased blood pressure. Rationale: weight loss is an effective lifestyle modification to lower blood pressure. Even a modest reduction in body weight can lead to significant reductions in systolic and diastolic blood pressure. 24. A nurse is preparing to take the blood pressure of a patient. Which of the following actions can cause an inaccurate high reading? A. Having the patient sit for 5 minutes before taking the reading. B. Using a cuff that is too small for the patient's arm. C. Placing the cuff on bare skin. D. Measuring blood pressure in the dominant arm. Answer: B. Using a cuff that is too small for the patient's arm. Rationale: a cuff that is too small can cause a falsely high blood pressure reading because it will inflate too tightly, leading to inaccurate measurements. It is important to select the correct cuff size based on the patient's arm circumference. 25. A patient with uncontrolled hypertension is at increased risk for which of the following renal complications? A. Nephrotic syndrome. B. Glomerulonephritis. C. Hypertensive nephropathy. D. Acute tubular necrosis. Answer: C. Hypertensive nephropathy. Rationale: chronic uncontrolled hypertension can damage the kidney's blood vessels, leading to hypertensive nephropathy. Over time, this can progress to kidney failure, if not managed effectively. 26. A patient with a history of hypertension and hyperlipidemia is at high risk for which of the following cardiovascular complications? A. Atrial fibrillation. B. Myocardial infarction. C. Pericarditis. D. Aortic aneurysm. Answer: B. Myocardial infarction. Rationale: hypertension and hyperlipidemia both contribute to the development of atherosclerosis, which increases the risk of myocardial infarction, heart attack. Both conditions are major risk factors for coronary artery disease. 27. Which of the following is a key factor in the development of essential hypertension? A. Decreased blood volume. B. Decreased sympathetic nervous system activity. C. Overactivity of the renin-angiotensin-aldosterone system. D. Insulin resistance. Answer: C. Overactivity of the renin-angiotensin-aldosterone system. Rationale: essential hypertension often involves the overactivity of the RAS, leading to sodium and water retention, increased vascular resistance, and ultimately higher blood pressure. Insulin resistance can also play a role, but is not the primary cause. 28. A patient with hypertension is being started on a diuretic. Which of the following interventions should the nurse prioritize to minimize potential adverse effects of the medication? A. Monitor for signs of dehydration. B. Monitor for signs of hypoglycemia. C. Educate the patient on the importance of increasing potassium intake. D. Educate the patient on how to increase fluid intake. Answer: A. Monitor for signs of dehydration. Rationale: diuretics can cause dehydration by increasing urine output, so the nurse should monitor for signs of dehydration, e.g., dry mouth, decreased urine output. While potassium monitoring and dietary changes are also important, dehydration is the most immediate concern. 29. Which of the following lifestyle modifications is most likely to have the greatest effect on lowering blood pressure in a patient with hypertension? A. Decrease alcohol consumption. B. Increase dietary sodium. C. Increase physical activity. D. Increase caffeine consumption. Answer: C. Increase physical activity. Rationale: regular physical activity, such as aerobic exercise, is one of the most effective lifestyle changes for lowering blood pressure. It helps improve cardiovascular fitness and reduces both systolic and diastolic blood pressure. 30. A 45-year-old patient is diagnosed with hypertension and is prescribed a diuretic. The nurse teaches the patient about possible side effects of the medication. Which of the following should the nurse emphasize? A. Risk of dehydration. B. Risk of weight gain. C. Risk of blood clots. D. Risk of allergic reactions. Answer: A. Risk of dehydration. Rationale: diuretics increase urine output, which can lead to dehydration if fluid intake is not adequately maintained. The nurse should emphasize the importance of drinking fluids and monitoring for signs of dehydration such as dizziness and dry mouth. 31. A nurse is educating a patient about lifestyle modifications to manage hypertension. Which of the following interventions would most likely have the greatest impact on blood pressure reduction? A. Increase physical activity. B. Decrease sodium intake. C. Limit caffeine intake. D. Reduce alcohol intake. Answer: A. Increase physical activity. Rationale: increasing physical activity, especially regular aerobic exercise, is one of the most effective lifestyle modifications to lower blood pressure. It improves cardiovascular health and helps reduce both systolic and diastolic blood pressure. 32. A 65-year-old patient with a history of hypertension is prescribed an ACE inhibitor. Which of the following is a common side effect of ACE inhibitors that the nurse should monitor? A. Hyperkalemia. B. Hypoglycemia. C. Constipation. D. Weight gain. Answer: A. Hyperkalemia. Rationale: ACE inhibitors can lead to hyperkalemia, elevated potassium levels, by inhibiting aldosterone, which reduces potassium excretion. The nurse should monitor potassium levels closely to prevent dangerous arrhythmias. 33. Which of the following blood pressure measurements indicates a hypertensive crisis in a patient? A. 130/85 mmHg. B. 140/90 mmHg. C. 160/100 mmHg. D. 180/120 mmHg. Answer: D. 180/120 mmHg. Rationale: a hypertensive crisis is characterized by blood pressure readings of 180/120 mmHg or higher. This requires immediate medical intervention to prevent life-threatening complications such as stroke or organ damage. 34. Which of the following is a primary goal in the management of hypertension? A. Normalize blood pressure to 120/80 mmHg. B. Prevent target organ damage. C. Lower cholesterol levels. D. Decrease blood volume. Answer: B. Prevent target organ damage. Rationale: the primary goal of hypertension management is to prevent long-term complications such as stroke, heart failure, and kidney damage. While achieving optimal blood pressure is important, the focus is on preventing damage to organs affected by chronic high blood pressure. 35. A nurse is assessing a patient with hypertension who is taking a beta blocker. Which of the following side effects is most commonly associated with beta blockers? A. Bradycardia. B. Hyperglycemia. C. Hypokalemia. D. Constipation. Answer: A. Bradycardia. Rationale: beta blockers reduce heart rate and can cause bradycardia, especially in patients with already low heart rates. The nurse should monitor heart rate and assess for signs of inadequate perfusion, such as dizziness or fatigue. 36. A nurse is caring for a patient with hypertension and renal insufficiency. Which of the following medications should be used cautiously in this patient? A. ACE inhibitor. B. Beta blocker. C. Thiazide diuretic. D. Calcium channel blocker. Answer: A. ACE inhibitor. Rationale: ACE inhibitors can impair kidney function, especially in patients with pre-existing renal insufficiency. The nurse should monitor kidney function, including serum creatinine and glomerular filtration rate, GFR, closely when ACE inhibitors are used. 37. A 45-year-old patient with hypertension is concerned about the need for lifelong medication. Which of the following is the most appropriate response from the nurse? A. You may stop your medication once your blood pressure is normal. B. Hypertension is a chronic condition and lifelong treatment is often necessary. C. You only need medication if your blood pressure goes over 160/100 mmHg. D. You can stop medication if you lose weight and exercise. Answer: B. Hypertension is a chronic condition and lifelong treatment is often necessary. Rationale: hypertension is a chronic condition that often requires lifelong management to prevent complications. Blood pressure may be controlled with lifestyle modifications, but medication is often necessary to maintain normal blood pressure over time. 38. A 60-year-old patient with hypertension is being started on a diuretic. Which of the following should the nurse monitor most closely to avoid a potential adverse effect of the medication? A. Serum calcium levels. B. Serum potassium levels. C. Serum sodium levels. D. Serum creatinine levels. Answer: B. Serum potassium levels. Rationale: diuretics, especially thiazide diuretics, can cause hypokalemia, low potassium levels. The nurse should monitor potassium levels to prevent complications such as arrhythmias. 39. A patient with hypertension is prescribed a combination of a diuretic and an ACE inhibitor. What is the benefit of this combination? A. Reduces the risk of dehydration. B. Reduces the risk of hypokalemia. C. Enhances blood pressure reduction. D. Increases blood glucose levels. Answer: C. Enhances blood pressure reduction. Rationale: combining a diuretic with an ACE inhibitor is an effective strategy for managing hypertension. The diuretic helps lower blood volume and reduce blood pressure, while the ACE inhibitor dilates blood vessels and further lowers blood pressure, providing an enhanced therapeutic effect. 40. A nurse is caring for a patient who has hypertension and diabetes. Which of the following antihypertensive medications is most appropriate for this patient? A. Thiazide diuretic. B. Beta blocker. C. ACE inhibitor. D. Calcium channel blocker. Answer: C. ACE inhibitor. Rationale: ACE inhibitors are preferred for hypertensive patients with diabetes because they help protect kidney function, which can be compromised in diabetic patients. Additionally, they have beneficial effects on blood pressure and are less likely to affect glucose metabolism. 41. A patient with hypertension presents with blurry vision and severe headache. The nurse suspects hypertensive retinopathy. Which of the following is the most likely cause of these symptoms? A. Increased intracranial pressure. B. Damage to the retinal blood vessels. C. Increased intraocular pressure. D. Narrowing of the arteries in the neck. Answer: B. Damage to the retinal blood vessels. Rationale: hypertensive retinopathy occurs when high blood pressure damages the blood vessels in the retina. Symptoms can include blurry vision and headaches, which are indicative of retinal damage due to prolonged hypertension. 42. Which of the following statements by a patient with hypertension indicates the need for further education about lifestyle changes? A. I will try to reduce the amount of salt in my diet. B. I plan to exercise 30 minutes a day most days of the week. C. I can drink alcohol in moderation as long as I stay below 100 ounces per day. D. I will reduce my intake of high-fat foods like red meat and fried foods. Answer: C. I can drink alcohol in moderation as long as I stay below 100 ounces per day. Rationale: drinking 100 ounces of alcohol per day is excessive and can increase blood pressure. The nurse should educate the patient about the risks of alcohol consumption and recommend a much lower daily limit, e.g., 1 drink per day. 43. A patient with uncontrolled hypertension is admitted to the hospital with a stroke. Which of the following interventions is most appropriate for this patient? A. Administer thrombolytics immediately. B. Administer antihypertensive medication cautiously. C. Perform immediate surgery to correct the blood pressure. D. Provide oxygen therapy to prevent hypoxia. Answer: B. Administer antihypertensive medication cautiously. Rationale: in patients with a stroke and uncontrolled hypertension, blood pressure should be lowered cautiously to avoid worsening ischemia or causing further damage. The goal is to reduce blood pressure gradually while monitoring for complications. 44. Which of the following is a key characteristic of secondary hypertension? A. It occurs without any known cause. B. It is most common in older adults. C. It is often related to an identifiable underlying cause. D. It resolves without treatment in most cases. Answer: C. It is often related to an identifiable underlying cause. Rationale: secondary hypertension is high blood pressure that results from an underlying condition such as kidney disease, hyperthyroidism, or sleep apnea. Unlike primary hypertension, which has no known cause, secondary hypertension is caused by a specific health issue. 45. A nurse is caring for a patient who is taking a calcium channel blocker for hypertension. Which of the following is the most common side effect of this medication class? A. Reflex tachycardia. B. Dizziness and lightheadedness. C. Bradycardia. D. Muscle cramps. Answer: B. Dizziness and lightheadedness. Rationale: calcium channel blockers can cause dizziness and lightheadedness, especially when the patient stands up quickly, due to their effect on lowering blood pressure. These medications can also cause peripheral edema, but dizziness is the most common side effect. 46. A 50-year-old patient with a history of hypertension is prescribed an angiotensin-converting enzyme, ACE, inhibitor. What is the primary effect of ACE inhibitors in hypertension management? A. Reduces sodium reabsorption in the kidneys. B. Increases vasoconstriction in the arteries. C. Blocks the conversion of angiotensin I to angiotensin II. D. Increases heart rate to improve blood circulation. Answer: C. Blocks the conversion of angiotensin I to angiotensin II. Rationale: ACE inhibitors block the enzyme that converts angiotensin I to angiotensin II, a potent vasoconstrictor. By preventing this conversion, ACE inhibitors help relax blood vessels, lowering blood pressure and reducing the workload on the heart. 47. A nurse is educating a patient about the potential side effects of a beta blocker. Which of the following should the nurse include in the teaching? A. Increased heart rate. B. Decreased blood pressure. C. Hyperglycemia. D. Increased appetite. Answer: B. Decreased blood pressure. Rationale: beta blockers lower blood pressure by blocking the effects of the sympathetic nervous system, which results in a decrease in heart rate and blood pressure. This can help control hypertension but should be monitored carefully to avoid excessive hypotension. 48. A patient with hypertension is prescribed a direct vasodilator. Which of the following is the most likely effect of this medication? A. Decrease in heart rate. B. Relaxation of smooth muscles in the blood vessels. C. Increase in kidney filtration rate. D. Increased aldosterone secretion. Answer: B. Relaxation of smooth muscles in the blood vessels. Rationale: direct vasodilators work by relaxing smooth muscles in blood vessel walls, which leads to vasodilation and a reduction in blood pressure. This can help lower blood pressure in patients with hypertension. 49. A 40-year-old patient with newly diagnosed hypertension is concerned about the potential need for lifelong medication. The nurse's best response would be: A. You may stop medication if you maintain a healthy lifestyle. B. Hypertension is often a lifelong condition, and medication helps control it. C. Once your blood pressure is normal, you can discontinue the medication. D. You may only need medication if your blood pressure becomes elevated again. Answer: B. Hypertension is often a lifelong condition, and medication helps control it. Rationale: hypertension is often a chronic condition, and lifelong management, including medication, may be necessary to prevent complications. Lifestyle changes can complement treatment, but are typically not enough to control blood pressure alone. 50. A patient with hypertension has been prescribed an alpha blocker. Which of the following is a potential side effect of this medication? A. Dry mouth. B. Orthostatic hypotension. C. Tachycardia. D. Increased appetite. Answer: B. Orthostatic hypotension. Rationale: alpha blockers can cause orthostatic hypotension, a drop in blood pressure when standing, as they block alpha-adrenergic receptors that help maintain vascular tone. The nurse should educate the patient to rise slowly to prevent dizziness or fainting. 51. A patient with hypertension is prescribed a loop diuretic. Which of the following should the nurse monitor closely while the patient is on this medication? A. Serum calcium levels. B. Serum potassium levels. C. Serum glucose levels. D. Serum sodium levels. Answer: B. Serum potassium levels. Rationale: loop diuretics can cause significant potassium loss, leading to hypokalemia. The nurse should monitor the patient's potassium levels closely to prevent complications such as arrhythmias. 52. A 70-year-old patient is prescribed an antihypertensive medication that may cause dizziness when standing up. The nurse should teach the patient to A. Increase fluid intake. B. Rise slowly from a sitting or lying position. C. Avoid all physical activity to prevent dizziness. D. Lie down if dizziness occurs. Answer: B. Rise slowly from a sitting or lying position. Rationale: dizziness, when standing up, is a common side effect of many antihypertensive medications, especially when there is a sudden drop in blood pressure, orthostatic hypotension. Rising slowly helps to minimize this effect. 53. A nurse is educating a patient about the DASH diet to manage hypertension. Which of the following foods is encouraged on the DASH diet? A. Processed meats. B. Full-fat dairy products. C. Fresh fruits and vegetables. D. Foods high in sodium. Answer: C. Fresh fruits and vegetables. Rationale: the DASH dietary approaches to stop hypertension diet emphasizes the consumption of fresh fruits, vegetables, whole grains, and low-fat dairy products. It is designed to help lower blood pressure by reducing sodium intake and increasing nutrient-rich foods. 54. A nurse is preparing to administer a dose of a thiazide diuretic to a patient with hypertension. Which of the following should the nurse assess before administering this medication? A. Blood glucose levels. B. Serum potassium levels. C. Serum sodium levels. D. Liver function. Answer: B. Serum potassium levels. Rationale: thiazide diuretics can cause hypokalemia, low potassium levels, so it is essential to monitor potassium levels before administering the medication. Hypokalemia can lead to dangerous arrhythmias. 55. A patient with hypertension asks the nurse about the role of the kidneys in blood pressure regulation. The nurse's best response is A. The kidneys help regulate blood pressure by controlling the volume of blood through fluid and sodium balance. B. The kidneys only affect blood pressure through the release of renin. C. The kidneys have no significant role in regulating blood pressure. D. The kidneys help lower blood pressure by increasing urine output. Answer: A. The kidneys help regulate blood pressure by controlling the volume of blood through fluid and sodium balance. Rationale: the kidneys play a critical role in regulating blood pressure by adjusting the amount of sodium and fluid in the body. This affects blood volume and, in turn, blood pressure. 56. A patient with hypertension is prescribed a direct vasodilator. Which of the following is the primary effect of direct vasodilators? A. Decrease in heart rate. B. Increased blood flow to the kidneys. C. Relaxation of blood vessel walls. D. Reduction in blood sugar levels. Answer: C. Relaxation of blood vessel walls. Rationale: direct vasodilators work by relaxing the smooth muscles in the blood vessel walls, which helps to dilate the vessels and reduce blood pressure. This mechanism directly lowers vascular resistance. 57. A nurse is reviewing the medications for a patient with hypertension. Which of the following medications is most likely to cause a persistent cough as a side effect? A. Calcium channel blocker. B. ACE inhibitor. C. Beta blocker. D. Angiotensin II receptor blocker. Answer: B. ACE inhibitor. Rationale: ACE inhibitors are known to cause a persistent dry cough in some patients. This occurs due to the accumulation of bradykinin, a peptide that is normally broken down by ACE. 58. A patient with hypertension and heart failure is prescribed a medication that can help reduce both blood pressure and heart workload. Which medication class is most likely prescribed? A. ACE inhibitor. B. Calcium channel blocker. C. Thiazide diuretic. D. Beta blocker. Answer: A. ACE inhibitor. Rationale: ACE inhibitors are commonly prescribed for patients with both hypertension and heart failure because they help to lower blood pressure and reduce the heart's workload. They also help prevent kidney damage, which is common in heart failure. 59. A 62-year-old patient with uncontrolled hypertension presents to the clinic with complaints of shortness of breath and fatigue. Which of the following complications of uncontrolled hypertension is the most likely cause of these symptoms? A. Renal failure. B. Coronary artery disease. C. Heart failure. D. Stroke. Answer: C. Heart failure. Rationale: Uncontrolled hypertension can lead to left ventricular hypertrophy and heart failure due to the increased workload on the heart. Shortness of breath and fatigue are common symptoms of heart failure. 60. A nurse is preparing a patient with hypertension for a renal artery duplex ultrasound. The nurse should explain that this test is used to assess for A. Hypertensive retinopathy, B. Renal artery stenosis, C. Heart failure, D. Pulmonary embolism. Answer: B. Renal artery stenosis. Rationale: a renal artery duplex ultrasound is used to assess for renal artery stenosis, which is a potential cause of secondary hypertension. It helps identify narrowing of the renal arteries that can lead to increased blood pressure. 61. A patient who has been taking antihypertensive medication for several months is now experiencing fatigue, dizziness, and fainting episodes. Which of the following should the nurse assess first? A. Blood pressure, B. Serum potassium levels, C. Electrocardiogram, ECG, D. Oxygen saturation. Answer: A. Blood pressure. Rationale: the symptoms of fatigue, dizziness, and fainting may indicate that the patient's blood pressure is too low, possibly due to the antihypertensive medication. The nurse should assess blood pressure to determine if hypotension is the cause of these symptoms. 62. A nurse is reviewing the lab results of a patient with hypertension who is taking a potassium-sparing diuretic. The nurse notes that the potassium level is elevated. The nurse should A. Decrease the dosage of the diuretic, B. Continue the diuretic as prescribed, C. Increase potassium intake through dietary changes, D. Monitor for signs of hypokalemia. Answer: A. Decrease the dosage of the diuretic. Rationale: potassium-sparing diuretics can cause hyperkalemia, elevated potassium levels. If the potassium level is elevated, the nurse should notify the healthcare provider to adjust the medication dosage or consider alternative treatment. 63. Which of the following non-pharmacological interventions is most effective for long-term management of hypertension? A. Increasing caffeine intake, B. Reducing sodium intake, C. Increasing intake of processed foods, D. Smoking cessation. Answer: B. Reducing sodium intake. Rationale: reducing sodium intake is one of the most effective lifestyle modifications for managing hypertension. It helps decrease fluid retention, reducing blood volume and lowering blood pressure. 64. A nurse is caring for a patient with secondary hypertension due to hyperaldosteronism. Which of the following is a likely symptom of this condition? A. Hypokalemia, B. Hyperkalemia, C. Hypoglycemia, D. Hyperglycemia. Answer: A. Hypokalemia. Rationale: hyperaldosteronism increases the secretion of aldosterone, which leads to increased sodium retention and potassium excretion, causing hypokalemia, low potassium levels. 65. A 50-year-old patient with hypertension asks the nurse about the effect of exercise on blood pressure. The nurse's response should be A. Exercise increases blood pressure temporarily, but is helpful in the long term. B. Exercise is not recommended for people with hypertension. C. Exercise should be avoided as it can cause dangerous spikes in blood pressure. D. Exercise will not have any effect on your blood pressure. Answer: A. Exercise increases blood pressure temporarily, but is helpful in the long term. Rationale: physical activity temporarily increases blood pressure during exercise, but regular aerobic exercise helps lower blood pressure in the long run by improving cardiovascular fitness and reducing vascular resistance. 66. A patient with hypertension is prescribed a medication that can cause sexual dysfunction as a side effect. The nurse should A. Ignore the patient's concerns, as sexual dysfunction is not a common side effect. B. Tell the patient that the medication will cause sexual dysfunction. C. Discuss the side effects of the medication and provide strategies for managing them. D. Encourage the patient to stop the medication immediately. Answer: C. Discuss the side effects of the medication and provide strategies for managing them. Rationale: sexual dysfunction can be a side effect of certain antihypertensive medications, especially beta blockers. The nurse should discuss this potential side effect with the patient and offer solutions or alternative treatments to manage it. 67. Which of the following best describes the mechanism of action of ACE inhibitors in the treatment of hypertension? A. They dilate the blood vessels by inhibiting calcium influx into smooth muscle cells. B. They increase sodium and water retention by blocking aldosterone. C. They block the conversion of angiotensin I to angiotensin II, causing vasodilation. D. They increase the heart rate to improve blood circulation. Answer. C. They block the conversion of angiotensin I to angiotensin II, causing vasodilation. Rationale. ACE inhibitors block the enzyme that converts angiotensin I to angiotensin II, which prevents vasoconstriction and leads to vasodilation, ultimately lowering blood pressure. 68. A 60-year-old patient is prescribed hydrochlorothiazide for hypertension. The nurse should monitor for which of the following potential side effects of thiazide diuretics? A. Hyperkalemia. B. Dehydration. C. Hypoglycemia. D. Bradycardia. Answer. B. Dehydration. Rationale. Thiazide diuretics can cause dehydration by increasing fluid excretion. The nurse should monitor the patient for signs of dehydration such as dry mouth, decreased urine output, or dizziness. 69. A nurse is educating a patient about the use of a home blood pressure monitor. Which of the following instructions is most important? A. Take your blood pressure immediately after you wake up in the morning. B. Make sure your arm is at heart level while taking the measurement. C. Use the monitor only once per week to check your blood pressure. D. Take your blood pressure after eating a large meal. Answer. B. Make sure your arm is at heart level while taking the measurement. Rationale. To get an accurate blood pressure reading, the patient should ensure that the arm is at heart level while taking the measurement. This ensures that the reading is not artificially elevated or lowered by improper positioning. 70. A nurse is caring for a patient with hypertensive crisis. Which of the following medications is most likely to be used in the treatment of this condition? A. Nifedipine. B. Lisinopril. C. Nitroglycerin. D. Hydralazine. Answer. D. Hydralazine. Rationale. Hydralazine is a direct vasodilator that can be used to rapidly reduce blood pressure in patients with hypertensive crisis. It works by relaxing smooth muscles in blood vessels, leading to vasodilation and a decrease in blood pressure. 71. A 60-year-old patient with uncontrolled hypertension is diagnosed with left ventricular hypertrophy, LVH. Which of the following is a common symptom of LVH? A. Severe chest pain. B. Shortness of breath on exertion. C. Tachycardia. D. Leg swelling. Answer. B. Shortness of breath on exertion. Rationale. Left ventricular hypertrophy occurs when the left ventricle becomes thickened due to increased workload from hypertension. This can impair the heart's ability to pump effectively, causing symptoms like shortness of breath, particularly during physical activity. 72. A patient with hypertension is prescribed an alpha-adrenergic blocker. The nurse should inform the patient to expect which of the following common side effects. A. Increased heart rate. B. Dizziness when standing up. C. Increased urine output. D. Bradycardia. Answer. B. Dizziness when standing up. Rationale. Alpha-adrenergic blockers can cause orthostatic hypotension, which leads to dizziness when the patient stands up suddenly. The nurse should advise the patient to rise slowly from a sitting or lying position to prevent this side effect. 73. A nurse is educating a patient with hypertension about the importance of regular monitoring of blood pressure at home. Which of the following is a key point the nurse should emphasize? A. You should measure your blood pressure 3 times a day. B. Make sure to take your blood pressure after you eat. C. Avoid taking blood pressure readings while you are lying down. D. Take your blood pressure at the same time every day, preferably in the morning. Answer. D. Take your blood pressure at the same time every day, preferably in the morning. Rationale. For consistent and accurate readings, blood pressure should be measured at the same time each day, ideally in the morning before any food or activity. This helps ensure the measurements are reliable for tracking changes. 74. A 55-year-old patient with hypertension is being started on an ACE inhibitor. Which of the following labs should be monitored regularly due to the potential side effect of hyperkalemia? A. Serum sodium levels. B. Serum calcium levels. C. Serum potassium levels. D. Blood urea nitrogen BUN. Answer: C. Serum potassium levels. Rationale: ACE inhibitors can increase potassium levels, leading to hyperkalemia. The nurse should monitor serum potassium regularly to prevent complications such as cardiac arrhythmias. 75. A nurse is assessing a patient who is taking an ACE inhibitor for hypertension. The nurse notes that the patient has developed a persistent dry cough. Which of the following actions is most appropriate? A. Discontinue the ACE inhibitor and notify the healthcare provider. B. Encourage the patient to drink more fluids. C. Recommend an over-the-counter cough suppressant. D. Continue the ACE inhibitor and monitor for other side effects. Answer: A. Discontinue the ACE inhibitor and notify the healthcare provider. Rationale: a persistent dry cough is a well-known side effect of ACE inhibitors. The nurse should discontinue the medication and notify the healthcare provider, who may consider switching the patient to an angiotensin II receptor blocker, ARB, if appropriate. 76. A patient with hypertension and chronic kidney disease, CKD, is being managed with an angiotensin II receptor blocker, ARB. What is the primary reason for using this class of medication in patients with CKD? A. ARBs lower blood pressure and protect the kidneys by reducing proteinuria. B. ARBs are more effective than ACE inhibitors in controlling blood pressure. C. ARBs prevent the absorption of sodium, thus lowering blood pressure. D. ARBs improve blood circulation to the kidneys. Answer: A. ARBs lower blood pressure and protect the kidneys by reducing proteinuria. Rationale: ARBs not only lower blood pressure but also reduce proteinuria, excess protein in the urine, which is a marker of kidney damage. This helps protect kidney function, which is especially important in patients with CKD. 77. A nurse is educating a patient with hypertension about lifestyle modifications. Which of the following changes will have the most significant impact on lowering blood pressure? A. Increasing the intake of caffeinated beverages. B. Reducing sodium intake and increasing physical activity. C. Adding more salt to meals. D. Increasing alcohol consumption. Answer: B. Reducing sodium intake and increasing physical activity. Rationale: reducing sodium intake and increasing physical activity are two of the most effective lifestyle changes for controlling blood pressure. These changes help reduce fluid retention, improve cardiovascular health, and lower blood pressure. 78. A 70-year-old patient with hypertension has been prescribed a calcium channel blocker. The nurse should educate the patient about which potential side effect of this medication. A. Bradycardia. B. Swelling of the ankles and feet. C. Dry cough. D. Increased energy levels. Answer: B. Swelling of the ankles and feet. Rationale: calcium channel blockers can cause peripheral edema, swelling of the ankles and feet, as a side effect. The nurse should monitor for this and educate the patient about the possibility of this side effect. 79. A 68-year-old patient with a history of hypertension is admitted to the hospital with a suspected hypertensive emergency. Which of the following symptoms would most likely indicate a hypertensive emergency? A. Shortness of breath and chest pain. B. Low-grade fever and headache. C. Severe headache, blurred vision, and confusion. D. Mild dizziness and fatigue. Answer: C. Severe headache, blurred vision, and confusion. Rationale: hypertensive emergencies are characterized by a sudden and severe increase in blood pressure, often with symptoms such as severe headache, visual disturbances, and altered mental status. Immediate intervention is necessary to prevent organ damage. 80. A patient with hypertension is prescribed a potassium-sparing diuretic. Which of the following dietary modifications should the nurse recommend? A. Increase the intake of high potassium foods, such as bananas. B. Avoid foods that are high in sodium. C. Consume more foods high in calcium. D. Decrease the intake of fluids to prevent dehydration. Answer: A. Increase the intake of high potassium foods, such as bananas. Rationale: potassium-sparing diuretics help retain potassium, so patients may need to increase their intake of potassium-rich foods to prevent hypokalemia. Examples include bananas, oranges, and leafy green vegetables. 81. A patient with uncontrolled hypertension is prescribed clonidine. The nurse should monitor for which of the following potential side effects: A. Tachycardia. B. Sudden drop in blood pressure. C. Increased appetite. D. Constipation. Answer: B. A sudden drop in blood pressure. Rationale: clonidine is an alpha-2 adrenergic agonist that can cause a sudden and significant drop in blood pressure, especially when stopped abruptly. The nurse should monitor the patient closely for signs of hypotension and educate the patient about not discontinuing the medication suddenly. 82. A 55-year-old patient with hypertension is found to have a high salt intake in their diet. Which of the following is the most appropriate action the nurse should take? A. Suggest that the patient increase sodium to improve hydration. B. Teach the patient to reduce sodium intake by limiting processed foods. C. Recommend that the patient start taking potassium supplements. D. Tell the patient that sodium intake does not affect hypertension. Answer: B. Teach the patient to reduce sodium intake by limiting processed foods. Rationale: reducing sodium intake is one of the most effective lifestyle changes for controlling hypertension. The nurse should educate the patient on the importance of avoiding processed foods, which are often high in sodium. 83. A nurse is preparing to administer a thiazide diuretic to a patient with hypertension. Which laboratory value is most important to assess before administering this medication? A. Blood glucose levels. B. Serum potassium levels. C. Serum sodium levels. D. Serum creatinine levels. Answer: B. Serum potassium levels. Rationale: thiazide diuretics can cause hypokalemia, so it is important to assess the patient's potassium levels before administration. Low potassium can lead to dangerous arrhythmias. 84. A nurse is caring for a patient with hypertension who is experiencing dizziness and lightheadedness. Which of the following actions should the nurse take first? A. Measure the patient's blood pressure in both arms. B. Administer a dose of the antihypertensive medication. C. Help the patient to sit or lie down and elevate their legs. D. Offer the patient a glass of water to increase hydration. Answer: C. Help the patient to sit or lie down and elevate their legs. Rationale: dizziness and lightheadedness are common signs of orthostatic hypotension, which can occur with antihypertensive medications. The nurse should help the patient sit or lie down and elevate their legs to improve circulation and prevent fainting. 85. A patient with a history of hypertension is at risk for developing which of the following complications? A. Hypotension. B. Kidney damage. C. Hyperglycemia. D. Dehydration. Answer: B. Kidney damage. Rationale: chronic hypertension can lead to kidney damage due to the increased pressure on the blood vessels in the kidneys. Over time, this can result in chronic kidney disease. Regular monitoring of kidney function is important in patients with hypertension. 86. A 60-year-old patient with hypertension is being started on an antihypertensive medication. Which of the following would be a priority assessment for the nurse before starting the medication? A. Review the patient's blood glucose levels. B. Assess the patient's vital signs, particularly blood pressure. C. Check the patient's renal function. D. Assess the patient's dietary sodium intake. Answer: B. Assess the patient's vital signs, particularly blood pressure. Rationale: before administering an antihypertensive medication, the nurse should assess the patient's baseline blood pressure to ensure the medication is appropriate. This helps prevent hypotension and ensures that the treatment will effectively lower the patient's blood pressure. 87. A patient with hypertension is prescribed a beta blocker. Which of the following is a common side effect of beta blockers? A. Increased heart rate. B. Fatigue and dizziness. C. Increased appetite. D. Hyperglycemia. Answer: B. Fatigue and dizziness. Rationale: beta blockers can cause fatigue and dizziness due to their effects on heart rate and blood pressure. The nurse should monitor the patient for these side effects and advise the patient to rise slowly from a sitting position to reduce dizziness. 88. A nurse is educating a patient with hypertension about the DASH diet. Which of the following foods should the patient focus on increasing in their diet? A. Processed meats. B. Whole grains. C. Full-fat dairy products. D. Fried foods. Answer: B. Whole grains. Rationale: the dietary approaches to stop hypertension diet emphasizes the consumption of whole grains, fruits, vegetables, and low-fat dairy products. Whole grains help provide fiber and nutrients that can help lower blood pressure. 89. A patient is diagnosed with hypertension and is prescribed a diuretic. The nurse should monitor for signs of which electrolyte imbalance? A. Hypercalcemia. B. Hypokalemia. C. Hyperkalemia. D. Hyponatremia. Answer: B. Hypokalemia. Rationale: diuretics, especially thiazide diuretics, can cause the excretion of potassium, leading to hypokalemia. The nurse should monitor potassium levels and watch for signs such as muscle weakness, cramping, or arrhythmias. 90. A nurse is assessing a patient with hypertension. Which of the following symptoms may indicate a hypertensive emergency? A. Chest pain and shortness of breath. B. Headache, blurred vision, and nausea. C. Tachycardia and elevated temperature. D. Fatigue and dizziness. Answer: B. Headache, blurred vision, and nausea. Rationale: hypertensive emergencies often present with symptoms such as severe headache, blurred vision, and nausea due to the acute increase in blood pressure. Immediate intervention is required to prevent organ damage. 91. A nurse is educating a patient with hypertension about the potential consequences of untreated high blood pressure. Which of the following is a potential complication of long-term uncontrolled hypertension? A. Improved kidney function. B. Decreased risk of heart disease. C. Stroke. D. Weight gain. Answer: C. Stroke. Rationale: untreated hypertension can damage the blood vessels, increasing the risk of stroke. Chronic high blood pressure can lead to the rupture of blood vessels in the brain or cause clot formation, leading to a stroke. 92. A nurse is teaching a patient with hypertension about the importance of medication adherence. Which of the following statements by the patient indicates a need for further teaching? A. I will take my medication as prescribed, even if I feel fine. B. I will make sure to follow up with my healthcare provider regularly. C. I can stop my medication if I feel that my blood pressure is normal. D. I will continue to monitor my blood pressure at home. Answer: C. I can stop my medication if I feel that my blood pressure is normal. Rationale: patients should not stop antihypertensive medications without consulting their healthcare provider. Stopping the medication can result in a rebound increase in blood pressure, leading to serious complications. 93. A 50-year-old patient with hypertension and a family history of cardiovascular disease is prescribed a calcium channel blocker. Which of the following is a common side effect of this medication class? A. Weight gain. B. Peripheral edema. C. Increased heart rate. D. Dry mouth. Answer: B. Peripheral edema. Rationale: calcium channel blockers can cause peripheral edema, swelling of the legs and ankles, as a common side effect. This is due to the vasodilatory effects of the medication on blood vessels in the lower extremities. 94. A nurse is assessing a 70-year-old patient with hypertension who is prescribed a beta blocker. Which of the following vital signs should be monitored closely due to the risk of bradycardia? A. Respiratory rate. B. Oxygen saturation. C. Heart rate. D. Blood pressure. Answer: C. Heart rate. Rationale: beta blockers slow the heart rate by blocking beta-adrenergic receptors. The nurse should closely monitor the patient's heart rate for bradycardia, especially if the patient develops symptoms such as dizziness or fatigue. 95. A nurse is providing education to a patient with hypertension regarding the role of diuretics. Which of the following statements by the patient indicates an understanding of the medication's purpose? A. Diuretics help by relaxing my blood vessels. B. Diuretics help lower blood pressure by decreasing fluid volume. C. Diuretics increase my sodium levels to help reduce pressure. D. Diuretics block the action of aldosterone to increase blood pressure. Answer: B. Diuretics help lower blood pressure by decreasing fluid volume. Rationale: Diuretics work by removing excess fluid and sodium from the body, which helps to lower blood pressure by reducing blood volume and the strain on the heart and blood vessels. 96. A nurse is caring for a patient with hypertension who is prescribed an ACE inhibitor. Which of the following laboratory values should the nurse monitor for potential adverse effects of the medication? A. Serum sodium. B. Serum potassium. C. Blood glucose levels. D. Serum calcium. Answer: B. Serum potassium. Rationale: ACE inhibitors can cause hyperkalemia, elevated potassium levels, which can lead to dangerous arrhythmias. The nurse should monitor potassium levels regularly to prevent this complication. 97. A patient with hypertension is prescribed an angiotensin II receptor blocker, ARB. Which of the following is a common side effect of ARBs? A. Persistent dry cough. B. Dizziness and lightheadedness. C. Hyperkalemia. D. Weight loss. Answer: B. Dizziness and lightheadedness. Rationale: ARBs can cause dizziness and lightheadedness, particularly when standing up quickly. This is a result of the blood pressure-lowering effect of the medication. The patient should be educated to rise slowly from a sitting or lying position. 98. A nurse is educating a patient with hypertension on the DASH diet. Which of the following foods should the nurse recommend the patient increase in their diet? A. Processed meats. B. Whole grains. C. Full-fat dairy. D. Fried foods. Answer: B. Whole grains. Rationale: the DASH, dietary approaches to stop hypertension, diet emphasizes the consumption of whole grains, fruits, vegetables, and low-fat dairy products. Whole grains are rich in fiber, which helps control blood pressure. 99. A 62-year-old patient with hypertension is prescribed hydralazine for hypertensive crisis. The nurse should monitor for which of the following side effects? A. Dehydration. B. Tachycardia. C. Hypotension. D. Bradycardia. Answer: B. Tachycardia. Rationale: hydralazine is a direct vasodilator used in hypertensive crisis. It can cause reflex tachycardia as a compensatory mechanism for the drop in blood pressure. The nurse should monitor the heart rate and blood pressure closely. 100. A nurse is educating a patient with hypertension about the importance of limiting alcohol intake. Which of the following is the most accurate statement about the relationship between alcohol and blood pressure? A. Alcohol has no effect on blood pressure. B. Alcohol can cause a slight increase in blood pressure, which can be harmful over time. C. Alcohol causes an immediate drop in blood pressure. D. Alcohol decreases the effectiveness of antihypertensive medications. Answer: B. Alcohol can cause a slight increase in blood pressure, which can be harmful over time. Rationale: chronic alcohol consumption can contribute to an increase in blood pressure. Over time, this can worsen hypertension and reduce the effectiveness of treatment. Patients should be advised to limit alcohol intake. 101. A nurse is caring for a patient with hypertension who has been prescribed a thiazide diuretic. Which of the following symptoms should the nurse educate the patient to report immediately? A. Swelling in the legs. B. Headache and blurry vision. C. Muscle weakness and cramping. D. Mild dizziness. Answer: C. Muscle weakness and cramping. Rationale: thiazide diuretics can cause electrolyte imbalances, including low potassium levels, hypokalemia, which can lead to muscle weakness and cramping. The patient should report these symptoms immediately, as they may indicate a need for electrolyte correction. 102. A nurse is assessing a patient with hypertension who is taking a diuretic. Which of the following laboratory values should the nurse assess regularly? 8. Serum creatinine and potassium levels. B. Serum calcium and blood glucose levels. C. Serum sodium and iron levels. D. Serum magnesium and cholesterol levels. Answer: A. Serum creatinine and potassium levels. Rationale: diuretics can affect kidney function and potassium levels. Monitoring serum creatinine ensures that kidney function is not impaired, and monitoring potassium helps prevent dangerous imbalances like hypokalemia or hyperkalemia. 103. A nurse is caring for a patient with hypertension who is newly prescribed a potassium-sparing diuretic. Which of the following foods should the nurse recommend the patient increase in their diet? A. Potatoes and bananas. B. Canned soups and processed meats. C. Cheese and yogurt. D. Red meat and eggs. Answer: A. Potatoes and bananas. Rationale: potassium-sparing diuretics help retain potassium, so patients should increase their intake of potassium-rich foods like bananas and potatoes to prevent hypokalemia. 104. A nurse is preparing to administer an antihypertensive medication to a patient who is also taking medications for diabetes. Which of the following interactions should the nurse be aware of? A. Antihypertensive medications can increase blood glucose levels. B. Antihypertensive medications can decrease blood glucose levels. C. Antihypertensive medications can cause dehydration, leading to hyperglycemia. D. Antihypertensive medications can interfere with insulin metabolism. Answer: B. Antihypertensive medications can decrease blood glucose levels. Rationale: some antihypertensive medications, especially beta blockers and ACE inhibitors, may have an impact on blood glucose control. The nurse should monitor blood glucose levels in patients with diabetes, as adjustments to insulin or oral hypoglycemic medications may be needed. 105. A nurse is educating a patient with hypertension about the use of an automatic blood pressure cuff. Which of the following instructions is most important? A. Take your blood pressure while standing to get the most accurate result. B. Make sure your arm is at heart level when measuring your blood pressure. C. Measure your blood pressure immediately after eating a large meal. D. Take your blood pressure after a brief walk to see how exercise affects it. Answer: B. Make sure your arm is at heart level when measuring your blood pressure. Rationale: to obtain an accurate blood pressure reading, the patient's arm should be at heart level. Measuring blood pressure at a different level can result in falsely high or low readings. 106. A nurse is caring for a patient with uncontrolled hypertension. Which of the following would most likely be seen in a patient with stage 3 hypertension? A. Persistent headache, blurry vision, and chest pain. B. Nausea and dizziness. C. Severe fatigue and weakness. D. Mild swelling in the ankles and legs. Answer: A. Persistent headache, blurry vision, and chest pain. Rationale: stage 3 hypertension, also known as hypertensive crisis, is characterized by severe symptoms, including persistent headache, blurred vision, chest pain, and potential organ damage. Immediate intervention is needed to manage the condition. 107. A patient with hypertension and chronic kidney disease, CKD, is prescribed an ACE inhibitor. Which of the following lab results should the nurse monitor closely? A. Potassium and creatinine levels. B. Sodium and calcium levels. C. Hemoglobin and hematocrit levels. D. Blood glucose and cholesterol levels. Answer: A. Potassium and creatinine levels. Rationale: ACE inhibitors can cause hyperkalemia and can affect kidney function. The nurse should monitor potassium levels to avoid hyperkalemia and creatinine levels to assess renal function. 108. A nurse is educating a patient about lifestyle modifications to manage hypertension. Which of the following recommendations is most likely to result in a significant reduction in blood pressure? A. Increasing sodium intake and reducing fluid intake. B. Exercising regularly and reducing alcohol intake. C. Increasing caffeine intake and reducing exercise. D. Reducing carbohydrate intake and increasing salt intake. Answer: B. Exercising regularly and reducing alcohol intake. Rationale: regular physical activity and reducing alcohol consumption are two of the most effective lifestyle modifications for managing hypertension. These changes help improve cardiovascular health and reduce blood pressure. 109. A nurse is providing discharge instructions to a patient who is newly diagnosed with hypertension. Which of the following should be included in the teaching plan? A. Take your blood pressure once a week. B. Limit your intake of fruits and vegetables. C. Take your antihypertensive medication exactly as prescribed. D. You can stop taking your medication when your blood pressure is normal. Answer: C. Take your antihypertensive medication exactly as prescribed. Rationale: it is essential for patients to adhere to their prescribed medication regimen for optimal blood pressure control. Stopping the medication prematurely can lead to a rebound increase in blood pressure. 110. A patient with hypertension is taking a diuretic and is experiencing excessive thirst, dry mouth, and frequent urination. Which of the following is the most likely cause of these symptoms? A. Dehydration due to excessive fluid loss from the diuretic. B. Hyperkalemia caused by the diuretic. C. A side effect of the antihypertensive medication. D. Fluid retention from kidney dysfunction. Answer: A. Dehydration due to excessive fluid loss from the diuretic. Rationale: diuretics promote fluid loss, which can lead to dehydration. Symptoms of dehydration include excessive thirst, dry mouth, and frequent urination. The nurse should monitor fluid balance and electrolytes closely. 111. A nurse is educating a patient with hypertension about the DASH diet. Which of the following is a primary goal of the DASH diet for managing hypertension? A. Increase sodium intake. B. Reduce cholesterol levels. C. Increase the intake of fruits and vegetables. D. Increase calorie intake. Answer: C. Increase the intake of fruits and vegetables. Rationale: the DASH diet emphasizes the consumption of fruits, vegetables, whole grains, and low-fat dairy. These foods help to lower blood pressure by providing nutrients like potassium, calcium, and magnesium. 112. A nurse is assessing a patient who has been prescribed an ACE inhibitor for hypertension. The patient reports a persistent dry cough. Which of the following should the nurse advise the patient? A. The cough is a normal side effect and will go away over time. B. You may need to stop the medication and speak with your healthcare provider. C. You should take a decongestant to help relieve the cough. D. You should drink warm liquids to soothe your throat. Answer: B. You may need to stop the medication and speak with your healthcare provider. Rationale: a persistent dry cough is a common side effect of ACE inhibitors. The nurse should advise the patient to contact their healthcare provider as a medication change may be necessary. 113. A patient is being started on a beta blocker for hypertension. Which of the following assessments should the nurse prioritize? A. Blood glucose levels. B. Heart rate and blood pressure. C. Potassium levels. D. Renal function. Answer: B. Heart rate and blood pressure. Rationale: beta blockers lower heart rate and blood pressure. It is essential for the nurse to monitor both parameters closely to ensure the medication is effective and to prevent excessive reductions in blood pressure or bradycardia. 114. A 65-year-old patient with hypertension is diagnosed with heart failure. Which of the following classes of medications is commonly prescribed to control both hypertension and heart failure? A. Diuretics. B. Calcium channel blockers. C. Beta blockers. D. Alpha blockers. Answer: C. Beta blockers. Rationale: beta blockers are commonly prescribed for both hypertension and heart failure as they help reduce the heart's workload and control blood pressure. They are beneficial in improving heart function in patients with heart failure. 115. A nurse is caring for a patient who is prescribed a thiazide diuretic for hypertension. The nurse should educate the patient to avoid which of the following foods due to the risk of causing a potassium imbalance? A. Bananas. B. Spinach. C. Salt substitutes. D. Potatoes. Answer: C. Salt substitutes. Rationale: salt substitutes often contain potassium chloride, which can increase potassium levels. Since thiazide diuretics can lower potassium, using salt substitutes can lead to hyperkalemia, which is dangerous. 116. A nurse is teaching a patient with hypertension about the risks of uncontrolled blood pressure. Which of the following statements by the patient indicates the need for further teaching? A. Uncontrolled hypertension can lead to heart disease and stroke. B. Hypertension can damage my kidneys and cause kidney failure. C. It's okay to stop taking my medication if my blood pressure is normal. D. I need to monitor my blood pressure regularly. Answer: C. It's okay to stop taking my medication if my blood pressure is normal. Rationale: patients with hypertension should never stop taking their medications without consulting their healthcare provider, as stopping the medication can lead to dangerous fluctuations in blood pressure and complications. 117. A nurse is caring for a patient with hypertension who is prescribed a calcium channel blocker. Which of the following is a common side effect of this medication? A. Constipation. B. Insomnia. C. Weight gain. D. Increased urination. Answer: A. Constipation. Rationale: calcium channel blockers can cause constipation as a common side effect due to their effect on smooth muscle relaxation in the gastrointestinal tract. The nurse should educate the patient about this and suggest ways to manage constipation, such as increasing fiber intake. 118. A nurse is caring for a patient with hypertension and is preparing to administer a loop diuretic. Which of the following lab values should the nurse monitor closely? A. Serum sodium. B. Serum potassium. C. Serum calcium. D. Serum phosphate. Answer: B. Serum potassium. Rationale: loop diuretics, like furosemide, can cause significant potassium loss, leading to hypokalemia. The nurse should monitor potassium levels closely and educate the patient about signs of low potassium, such as muscle weakness and irregular heart rhythms. 119. A nurse is reviewing a patient's medical history. The patient has hypertension, diabetes, and hyperlipidemia. Which of the following medications would be appropriate for managing all three conditions? A. Diuretics. B. ACE inhibitors. C. Calcium channel blockers. D. Beta blockers. Answer: B. ACE inhibitors. Rationale: ACE inhibitors can manage hypertension, protect kidney function in diabetic patients, and have cardiovascular benefits for patients with hyperlipidemia. They are often prescribed to manage multiple comorbidities in patients with cardiovascular risk. 120. A nurse is educating a patient with hypertension about the effects of stress on blood pressure. Which of the following is the most appropriate recommendation? A. Avoid all stressful situations. B. Practice relaxation techniques to manage stress. C. You can continue to experience stress, but medication will control your blood pressure. D. Take deep breaths only during high-stress situations. Answer: B. Practice relaxation techniques to manage stress. Rationale: chronic stress can increase blood pressure, so learning to manage stress through relaxation techniques like deep breathing, yoga, or meditation can help lower blood pressure over time. Avoiding all stressful situations is unrealistic, but stress management is essential for long-term hypertension control. 121. A nurse is assessing a patient with hypertension who is prescribed a calcium channel blocker. The nurse should monitor for which of the following adverse effects: A. Bradycardia. B. Hypokalemia. C. Hyperglycemia. D. Hypotension. Answer: D. Hypotension. Rationale: calcium channel blockers lower blood pressure by relaxing blood vessels. Therefore, hypotension is a common side effect, especially when the medication is first started. The nurse should monitor blood pressure closely. 122. A 55-year-old patient with hypertension is being started on an angiotensin-converting enzyme, ACE, inhibitor. Which of the following laboratory tests is most important to monitor during treatment? A. Serum creatinine. B. Serum calcium. C. Hemoglobin. D. Blood glucose. Answer: A. Serum creatinine. Rationale: ACE inhibitors can cause renal impairment. The nurse should monitor serum creatinine to assess kidney function, as a rise in creatinine levels may indicate kidney damage. 123. A nurse is caring for a patient who is newly diagnosed with hypertension. Which of the following lifestyle changes is most important to manage blood pressure? A. Decreasing protein intake. B. Increasing sodium intake. C. Engaging in regular physical activity. D. Reducing vitamin D intake. Answer: C. Engaging in regular physical activity. Rationale: regular physical activity is one of the most effective lifestyle changes for controlling blood pressure. Exercise improves heart function, reduces stress, and helps maintain a healthy weight, all of which contribute to lower blood pressure. 124. A nurse is preparing to discharge a patient with hypertension who is being prescribed a thiazide diuretic. Which of the following instructions should be included in the teaching plan? A. Take your diuretic in the evening before bed to avoid frequent urination. B. Eat foods rich in potassium, such as bananas and potatoes. C. Avoid drinking fluids during the day to prevent fluid retention. D. Limit your intake of high-protein foods. Answer. B. Eat foods rich in potassium, such as bananas and potatoes. Rationale. Thiazide diuretics can lead to potassium loss, so the nurse should advise the patient to increase their intake of potassium-rich foods to prevent hypokalemia. 125. A nurse is caring for a patient who is taking a loop diuretic. Which of the following electrolyte imbalances is most likely to occur with this medication? A. Hyperkalemia. B. Hyponatremia. C. Hypercalcemia. D. Hypokalemia. Answer. D. Hypokalemia. Rationale. Loop diuretics, like furosemide, are potent diuretics that cause the body to excrete large amounts of potassium, which can result in hypokalemia. The nurse should monitor potassium levels closely. 126. A 70-year-old patient with hypertension is prescribed a beta blocker. Which of the following is a potential side effect of this medication in elderly patients? A. Hypoglycemia. B. Orthostatic hypotension. C. Weight gain. D. Insomnia. Answer. B. Orthostatic hypotension. Rationale. Beta blockers can cause a drop in blood pressure upon standing, known as orthostatic hypotension. Elderly patients are particularly at risk for falls related to this side effect. The nurse should instruct the patient to rise slowly from a sitting or lying position. 127. A nurse is teaching a patient with hypertension about dietary changes. Which of the following foods should the patient avoid to help control blood pressure? A. Fresh fruits and vegetables. B. Whole grain bread and pasta. C. Processed meats and high-sodium snacks. D. Low-fat dairy products. Answer. C. Processed meats and high-sodium snacks. Rationale. High-sodium foods like processed meats and snacks contribute to increased blood pressure by causing fluid retention and vasoconstriction. The patient should avoid these foods as part of a blood pressure-lowering diet. 128. A nurse is assessing a patient with hypertension who is taking an ACE inhibitor. Which of the following signs may indicate a serious adverse effect of the medication? A. Swelling of the ankles. B. Persistent dry cough. C. Increased urination. D. Decreased appetite. Answer. A. Serum creatinine. Rationale. ACE inhibitors can cause renal impairment. The nurse should monitor serum creatinine to assess kidney function, as a rise in creatinine levels may indicate kidney damage. 129. A nurse is providing care for a patient with uncontrolled hypertension. Which of the following is the most likely long-term consequence of poorly managed hypertension? A. Glaucoma. B. Chronic kidney disease. C. Osteoarthritis. D. Asthma. Answer. B. Persistent dry cough. Rationale. A persistent dry cough is a known side effect of ACE inhibitors and may indicate an adverse reaction. The nurse should inform the healthcare provider if the patient experiences this symptom, as the medication may need to be changed. 130. A 60-year-old patient with hypertension presents with complaints of dizziness and blurred vision. The nurse suspects a hypertensive emergency. Which of the following actions is the priority? A. Administer the prescribed antihypertensive medication. B. Monitor vital signs and notify the healthcare provider. C. Encourage the patient to drink fluids. D. Position the patient in a comfortable sitting position. Answer. B. Chronic kidney disease. Rationale. Chronic hypertension can damage the blood vessels in the kidneys, leading to chronic kidney disease. Over time, uncontrolled hypertension is one of the most common causes of kidney failure. 131. A nurse is educating a patient on how to properly measure blood pressure at home. Which of the following is the most important instruction to include? A. Take your blood pressure after eating a large meal. B. Take your blood pressure while sitting in a chair with your feet flat on the floor. C. Take your blood pressure first thing in the morning before taking your medication. D. Take your blood pressure immediately after physical activity. Answer. B. Take your blood pressure while sitting in a chair with your feet flat on the floor. Rationale. For accurate blood pressure measurement, the patient should sit with their back supported, feet flat on the floor, and the arm at heart level. Avoid measuring blood pressure after meals or physical activity, as these can affect readings. 132. A nurse is caring for a patient with hypertension who is prescribed a combination of an ACE inhibitor and a diuretic. Which of the following laboratory values should the nurse monitor closely? A. Potassium and sodium levels. B. Calcium and phosphorus levels. C. Creatinine and blood urea nitrogen (BUN) levels. D. Hemoglobin and hematocrit levels. Answer: A. Potassium and sodium levels. Rationale: ACE inhibitors can increase potassium levels, and diuretics can cause potassium loss. Close monitoring of potassium and sodium levels is essential to prevent dangerous imbalances. 133. A nurse is assessing a patient with a history of hypertension who presents with a new onset of chest pain and shortness of breath. Which of the following actions should the nurse take first? A. Administer oxygen. B. Obtain a 12-lead electrocardiogram (ECG). C. Assess vital signs and oxygen saturation. D. Administer nitroglycerin. Answer: C. Assess vital signs and oxygen saturation. Rationale: before administering medications or interventions, it is important to assess the patient's vital signs and oxygen saturation. This helps determine the severity of the condition and guides further action. 134. A nurse is caring for a patient who is taking a beta blocker for hypertension. The nurse should monitor the patient for which of the following potential side effects? A. Hyperglycemia. B. Tachycardia. C. Bradycardia. D. Hypotension. Answer: C. Bradycardia. Rationale: beta blockers can cause bradycardia, slow heart rate, due to their action on the heart's beta receptors. The nurse should monitor the heart rate and notify the healthcare provider if the heart rate drops below 60 beats per minute. 135. A nurse is caring for a patient with hypertension who is being discharged with a prescription for a diuretic. The nurse should instruct the patient to monitor for signs of which electrolyte imbalance? A. Hyperkalemia. B. Hypoglycemia. C. Hypokalemia. D. Hypercalcemia. Answer: C. Hypokalemia. Rationale: diuretics, especially thiazide diuretics, can cause potassium loss, leading to hypokalemia. Symptoms of hypokalemia include muscle weakness, cramping, and arrhythmias. The nurse should educate the patient to watch for these signs. 136. A nurse is caring for a patient with hypertension who is receiving a prescription for clonidine. Which of the following instructions should the nurse include when teaching the patient about clonidine? A. Stop taking the medication immediately if you feel dizzy. B. Avoid abrupt discontinuation of this medication to prevent rebound hypertension. C. This medication can cause your blood pressure to rise. D. Take the medication on an empty stomach for better absorption. Answer: B. Avoid abrupt discontinuation of this medication to prevent rebound hypertension. Rationale: abruptly stopping clonidine can cause rebound hypertension, which can lead to severe complications. The nurse should instruct the patient to taper the dose gradually under the guidance of their healthcare provider. 137. A nurse is assessing a patient with hypertension. Which of the following factors contributes most to the development of primary hypertension? A. Excessive alcohol consumption. B. Genetic predisposition. C. Diabetes mellitus. D. Hypothyroidism. Answer: B. Genetic predisposition. Rationale: primary hypertension, essential hypertension, typically develops without an identifiable cause. Genetic factors are the most significant contributors to the development of primary hypertension. 138. A nurse is teaching a patient about the importance of medication adherence for managing hypertension. Which of the following statements by the patient indicates a need for further education? A. I will take my medication every day, even if my blood pressure is normal. B. I should never stop my medication without checking with my doctor. C. I can stop my medication when I feel better. D. I will track my blood pressure regularly to make sure it stays in a normal range. Answer: C. I can stop my medication when I feel better. Rationale: patients should not stop their antihypertensive medications without consulting their healthcare provider, as doing so can lead to an increase in blood pressure and potential complications. 139. A nurse is caring for a patient with a history of uncontrolled hypertension. Which of the following complications is the patient most at risk for? A. Liver failure. B. Stroke. C. Chronic obstructive pulmonary disease, COPD. D. Asthma. Answer: B. Stroke. Rationale: uncontrolled hypertension increases the risk of stroke due to the damage it causes to blood vessels, which can lead to rupture or blockage. Stroke is one of the most serious complications of uncontrolled hypertension. 140. A nurse is assessing a patient with hypertension and a history of stroke. Which of the following is the most important intervention for reducing the risk of another stroke? A. Increase potassium intake. B. Control blood pressure within normal limits. C. Encourage regular vigorous exercise. D. Administer high-dose aspirin daily. Answer: B. Control blood pressure within normal limits. Rationale: the most important intervention to reduce the risk of another stroke is controlling blood pressure. High blood pressure is the leading risk factor for stroke, and managing it effectively can prevent recurrence. 141. A patient with hypertension has been prescribed an angiotensin II receptor blocker, ARB. The nurse should monitor for which of the following adverse effects? A. Increased heart rate. B. Hyperkalemia. C. Hypoglycemia. D. Constipation. Answer: B. Hyperkalemia. Rationale: ARBs can increase potassium levels, leading to hyperkalemia. The nurse should monitor potassium levels regularly to avoid dangerous elevations that can cause cardiac arrhythmias. 142. A nurse is teaching a patient about hypertension. Which of the following lifestyle changes would be most beneficial for lowering blood pressure? A. Increase alcohol consumption in moderation. B. Reduce sodium intake and increase potassium-rich foods. C. Limit physical activity and rest more frequently. D. Increase intake of high-fat dairy products. Answer: B. Reduce sodium intake and increase potassium-rich foods. Rationale: reducing sodium intake and increasing potassium-rich foods, such as fruits and vegetables, is a key part of managing hypertension. Potassium helps counteract the effects of sodium and supports better blood pressure control. 143. A patient with hypertension is prescribed a calcium channel blocker. Which of the following side effects should the nurse warn the patient about? A. Dizziness and headaches. B. Insomnia and nightmares. C. Increased appetite and weight gain. D. Excessive thirst and frequent urination. Answer: A. Dizziness and headaches. Rationale: common side effects of calcium channel blockers include dizziness and headaches due to their vasodilatory effects. The nurse should educate the patient about these potential side effects and advise them to rise slowly from sitting or lying positions. 144. A nurse is caring for a patient with hypertension who is prescribed a diuretic. The nurse should monitor the patient for signs of which electrolyte imbalance? A. Hyperkalemia. B. Hypokalemia. C. Hypercalcemia. D. Hypoglycemia. Answer: B. Hypokalemia. Rationale: diuretics, especially thiazide diuretics, cause potassium loss, which can result in hypokalemia. Symptoms include muscle weakness, cramping, and arrhythmias, so monitoring potassium levels is crucial. 145. A patient with hypertension is prescribed a combination of an ACE inhibitor and a diuretic. Which of the following is the primary purpose of combining these medications? A. To reduce blood pressure more effectively. B. To prevent fluid retention caused by the ACE inhibitor. C. To increase the risk of hyperkalemia. D. To reduce the likelihood of developing a dry cough. Answer: A. To reduce blood pressure more effectively. Rationale: combining an ACE inhibitor with a diuretic can have a synergistic effect, leading to more effective blood pressure control. The diuretic helps lower blood pressure by promoting fluid loss, and the ACE inhibitor works by dilating blood vessels. 146. A nurse is teaching a patient about the importance of adhering to prescribed antihypertensive medications. Which of the following statements by the patient indicates a need for further teaching? A. I should take my medication at the same time every day. B. It is safe to stop taking my medication if I feel fine. C. I need to follow up with my healthcare provider regularly. D. I will monitor my blood pressure at home to track my progress. Answer: B. It is safe to stop taking my medication if I feel fine. Rationale: patients with hypertension should not stop their medication without consulting their healthcare provider, even if they feel fine. Stopping treatment prematurely can lead to rebound hypertension and other complications. 147. A nurse is caring for a patient with hypertension who has been prescribed a beta blocker. Which of the following assessments is most important for the nurse to monitor? A. Blood pressure and heart rate. B. Blood glucose levels. C. Respiratory rate and oxygen saturation. D. Renal function tests. Answer: A. Blood pressure and heart rate. Rationale: beta blockers lower blood pressure and slow the heart rate. The nurse should monitor both parameters closely to ensure the patient is not experiencing excessive bradycardia or hypotension. 148. A nurse is educating a patient with hypertension about the importance of reducing sodium intake. Which of the following foods should the patient avoid to help control blood pressure? A. Fresh fruits and vegetables. B. Low-fat dairy products. C. Processed meats and canned soups. D. Whole grain bread. Answer: C. Processed meats and canned soups. Rationale: processed meats and canned soups are typically high in sodium, which can raise blood pressure. Reducing sodium intake is crucial for blood pressure control. The patient should avoid or limit these foods in their diet. 149. A nurse is assessing a patient who is taking a potassium-sparing diuretic for hypertension. Which of the following laboratory results is most important to monitor? A. Serum potassium levels. B. Serum calcium levels. C. Serum glucose levels. D. Hemoglobin and hematocrit levels. Answer: A. Serum potassium levels. Rationale: potassium-sparing diuretics can cause hyperkalemia. The nurse should monitor serum potassium levels closely to avoid dangerous elevations that can cause cardiac arrhythmias. 150. A patient with hypertension is experiencing dizziness and lightheadedness. Which of the following should the nurse consider as the most likely cause? A. Low blood sugar. B. Side effect of antihypertensive medication. C. Anxiety or stress. D. Dehydration from excessive fluid intake. Answer: B. Side effect of antihypertensive medication. Rationale: dizziness and lightheadedness can be side effects of antihypertensive medications, particularly when blood pressure drops too low. The nurse should assess the patient's blood pressure and medication regimen.